Hi, how are you? My name is Tracy Fitzpatrick. I'm the Directorate Nurse Manager for the Cancer Directorate here in the Mater Public Hospital, and this
And I'm Siobhan Kelly. I'm the Nurse Manager for the inpatients up in the private.
So I suppose before I worked here, I worked in the Mater Private for 19 years, and probably one of the first patients I met was your dad, Michael Drew. He was a great patient of Professor Carney's, and we saw him through lots of treatment, lots of remission, and unfortunately some relapses as well. We loved seeing him coming in the door. He always had a nice word for everybody. And one of our colleagues, Aideen, who works with us now, shares a birthday with Michael, and he remembered her birthday every year with a really nice box of chocolates. So we used to fight over looking after him, and especially when he came in on a Saturday for his IVIG. And one day he was leaving and I had to run out the road after him with his wallet. And there was a few €50 tucked into the wallet. And on Echo Street in my uniform, he tried to give me €50 to buy sweets for my 5 children. So I did decline, but always he spoke so highly about his family, and he really approached his disease with courage, and he was such a compassionate person. And we loved listening to him, and we really enjoyed looking after him. Mary McHale also works with me now in the Mater Public, and Mary couldn't be here today, but I spoke about Mary and said that we were doing this and how kind your family were to Mary as well, and Aideen, one of our colleagues.
So I would have known Michael through the day ward, and then he used to come in for admissions to Elizabeth's. So we knew him a long time, but we used to have such a laugh on a Saturday in the day ward, because we used to call him like the guard coming in on Saturday, because he'd be in early, have everyone organised. And later, sort of on, he used to get a lot of restless legs. So it was like the sergeant going around the day ward doing laps. And patients sometimes used to go, "Are you checking on me?" I said, that's the guard we have.
The younger girls, when we met Michael first, and now we have, I know in the Mater Public, have over 100 cancer nurses in the Cancer Directorate, and really nurses that are educated to a really high degree. And we know that the more educated they become, the better the patient journey, the more compassion and the care they have, and the better the outcomes. There's nurses in acute diagnosis, in treatment, and now moving into survivorship, so managing patients at that part of their disease. The money you've raised to date, nearly €8,000, is such a fantastic benefit. We have nurses who go to UCD to do higher diplomas in oncology. We're educating nurses to master's level. We have advanced nurse practitioners, clinical nurse specialists, and we also have very young staff nurses as well who've just qualified, and our job is to attract them into oncology. And because I suppose we're really passionate about it, we've been here a few years,
I know.
so we're really passionate about it and really want to impart that to our younger colleagues. And this fund will give us an opportunity to see quality and see care in people, and encourage them to go on to further education to make that journey better for patients. So from all in the Mater Public, I would like to say thank you very much. And we would hope to feed back to you. It was great for myself and Siobhan. We had a cup of coffee today before we spoke to you. So it's a nice day to COVID. We haven't seen as much of each other with COVID, but we'd love to update you. And maybe when COVID is over, you could come in and meet some of our nurses. We'd really like that. And we could feed back to you how things went.
Yeah, and Prof Carney's very involved with this. Meeting with us, approving it, going through it, so it's just such a testament to their relationship as well. And have a relationship with someone for 30 years medically, it's a long time, and sometimes it can be the reason why you stay in oncology. You get to know patients and families, and all the stories, and the babies, and the birthdays, and giving out, and the good days and the bad days. So we really appreciate it. And yes, we do want, Carney Prof did retire during COVID, so there will be a day when we can all come and meet and go through everything. And
so
thank you.
So Professor Carney is a big fan of nurse education, and we've been through that challenge with them. So we're really delighted and we're really thankful, and we hope to invite you in to the Mater for a cup of tea. We'll do it halfway between. So we get some common ground between the private and the public. And thank you for including all the nurses on the street in this. We hope you're all keeping well, and as we come out of COVID, we hope you're all safe, and we look forward to seeing you soon. Thank you so much.
Thanks. Thank you. Bye. Thanks.